to start recording. All right, thank you all so much for joining us. Today is October 4th, and this is our English All-Come webinar for Oregon's 1115 Medicaid waiver. My name is Jessica Diaz. I use she, her pronouns, and I work for the Oregon Health Authority. I'm here to get us started, and then I'll hand it off to our main presenter today, Megan Auclair, who will also introduce herself when she starts talking. We have a pretty big agenda today, so I'm going to try my best to give us a good overview and sort of baseline pieces of information without spending a lot of extra time on it before handing it over to talk more about our timing for the different pieces of the health-related social needs and implementation, as well as talking in more details about those services and specifically focused on climate benefits. We then have a member service delivery walkthrough of the climate benefit, and we have time set aside to make sure that we are really focused on your questions and your thoughts, and that we are not spending all of our time talking, but also listening. As we talk about the 1115 Medicaid waiver, we want to make sure that everyone has the same baseline understanding of what we mean with our language. So we have, and each state has a Medicaid plan that we do with the federal government with a standard set of rules. But each state's different, and we also want to have room and space for innovation and to try new things. So one of those mechanisms is that we can ask for permission to change the rules using a waiver. So these waivers are working with the state and with the Centers for Medicare and Medicaid Services every 5 years. We go through a process where, for instance, here in Oregon, we say we'd like to try these 5 things. CMS says great, but we're a little concerned about one aspect of this. Let's talk through that and negotiate what that's going to look like. And then we get to a point where we can get to an accepted proposal and get to work. In Oregon, we've had waivers since 1994. We use them to make our Oregon health plan more flexible, really see if there are places we can provide services that we haven't in the past, cover people in ways we might not have been able to in the past. And this 5-year process has been continuing since then, with this most recent phase happening in late 2022. And this 5 years goes through 2027. There are many moving parts to waivers and to this particular waiver renewal. So we're not going to talk about all of them at length, and know that we have some that are even still in conversation and negotiation with the federal government. As we set out to adjust how we are doing Oregon Health Plan and Medicaid here in Oregon, we have these overarching goals, which really the top one is our absolute top one: address and advance health equity. I would say everything under that is one of the ways in which we want to do that. We want to make sure that we are creating a culturally, linguistically responsive and equitable healthcare system. We want to help people maintain their healthcare coverage and improve health outcomes, looking at things beyond sort of traditional medical lens into health-related social needs, which we'll be talking about in more depth today. And we want to make sure that as we do that, we're doing so in a smart and flexible way with our spending as well. One call out that we always want to make sure we are making is that in our goals to advance health equity, we are committed to covering Healthier Oregon OHP members in these 1115 waiver benefits, exactly like we would for anyone else who is on OHP. And Healthier Oregon members are folks who have OHP here in the state due to state action, regardless of their immigration status. There's a whole lot of changes that are underway. Some of these things have already started to be implemented, and people are seeing differences in their care when, for example, continuous eligibility is something that went live in July. And so children up to age 6 have continuous OHP eligibility from the time they get on OHP until they turn 6, regardless of changes in circumstances. And we're also able to offer 2 years of that continuous eligibility for people who are 6 and up. We're working to extend Oregon health plan eligibility for young children, youth, and adults in other ways as well, including coverage for young adults with special health care needs up to age 26. And then what we're going to be spending most of our time talking about today, those health-related social needs as well. And this is the part where I have quickly talked so that Megan can have more time. Megan, I'm handing it over to you.
Thank you, Jessica. Good morning, everyone. My name is Megan O'Clair. I use she, her pronouns, and I work for the Oregon Health Authority. I'm the project director for the 1115 waiver implementation. So my role is really to kind of coordinate across all the different areas that Jessica mentioned, and making sure that we keep folks informed and involved about what's going to happen. So let's go ahead and move into our topic of the day, which will focus today on the health-related social needs climate. So let's just sort of orient everyone to the timeline of activities here. So from what you can see here, we have a couple different tracks of work. So the climate is right up top. At the moment, we are in the process of sharing some draft rules. So Oregon administrative rules will go to a rules advisory committee near the end of this month. If you have questions about how you can get involved with that work or provide some input on those proposed rules, we can always share that information with you. But this will really set out the expectations for providers in administrative rule. We're also working around making some amendments to the CCO contract. So CCOs will be the ones who will administer these benefits for OHP members. And throughout the course of these next few months and the next couple of years, we want to continue to engage partners on our plans as we develop them, what the member experience will look like, and really hear from you sort of where we have either missed some of our assumptions or if there's considerations that we're not showing here that would be really, really relevant for us as we're thinking about how this will be operationalized and how it affects you. So let's go ahead and move to the next slide. So we'll be releasing a couple of documents that will hopefully help clarify what the expectations are, especially around data and systems. And again, looking for feedback from folks on how you might have some barriers to operationalizing this. And again, we've made some assumptions internally, but we want to hear from you all how this will affect you so that we don't make any decisions that will create an undue burden for the folks who are actually going to be doing the work. So from now until the end of this year, we're going to keep revising some of those documents and those plans. We'll be releasing guidance and member experience documents more towards the end of this year. And then again, the climate devices will be live and available for people beginning January 1st of 2020. Next slide, please. Okay, let's go ahead and keep going. So we'll focus today on the HRSN services and the climate benefit. So Jessica gave a really great overview of the waiver in general. Let's talk in more detail about what health-related social needs are. So this is one area that CMS approved for us at the end of 2020. So health-related social needs are really the areas that affect a person's health that are outside of just medical care. So it's the social and economic needs that impact someone's ability to maintain their health and well-being. So this is anything from being able to afford stable housing, being able to pay for utilities, having reliable transportation, access to healthy and affordable foods. So within this waiver, we were given approval from CMS to start spending in areas that we wouldn't normally have the ability to spend Medicaid funding on. So where we were given approval around the health-related social needs spending in 4 different areas. So housing supports, nutrition supports, climate-related needs, which is what we'll focus on today, and outreach and engagement. So these are the new types of services that we'll be able to provide under the Oregon Health Plan that we haven't previously been able to offer. Next slide, please. So in addition to approving the use of Medicaid funds, CMS also gave us a big chunk of money to help kickstart the ability to get access to these services. So we were given $119 million available as grants for infrastructure and capacity building. So as we're talking about how services will be delivered, we know that there's going to be some gaps in technology and training and workforce. And so we were given a portion of that money to invest in infrastructure and capacity building for HRSN providers. And then we were given the bulk of the remainder, which was really intended to focus on delivering services. So paying for those actual supports like housing supports, nutrition, climate devices, and that outreach and engagement. So we'll talk at a later date about sort of the grants for infrastructure and capacity building, but this is just sort of how the federal government has given us a little bit more funding opportunity to offer these services where we previously had not been able to. Next slide, please. Thank you. So let's talk about who is actually eligible to receive these benefits, because in this case, we're not talking about every OHP member. We are talking about a subset of folks who would be eligible to get these services. So when we were in discussions with CMS, the key point here was we wanted to smooth transitions, and we wanted to make sure that there were some additional supports for folks who were moving through either different stages of life, moving through between systems, or experiencing one-time or unexpected events such as a climate event or things of that nature. So there are different qualifications that a member has to meet in order to be eligible for HRSN services, and it does differ a little bit depending on which service we're talking about. So for example, in climate, we'll dig into that a little bit more soon, but a couple of things to highlight here. So you have to meet the eligibility criteria for being within one of those populations. Like I mentioned, we were focused on who's transitioning into different life situations or between systems as an example. And you also have to meet clinical and social risk criteria. So you have to have a demonstrated need for that service or that product in order for it to be approved for delivery. So another important area to note here, we want to make sure that these services that we've been offered from CMS to cover going forward are not actually replacing something that someone could potentially get through another program. So the idea being that Medicaid is here to help fill a gap where a gap exists, and we want to make sure that the existing programs that they might have access to either have determined that they've not met the criteria, or for some reason they would not be appropriate. So we're really trying to figure out where we can sort of fill that gap where there is one. Next slide, please. So let's talk about specifically who can receive the HRSN services. So these transition populations can include young adults who are aged 19 to 26 with special healthcare needs. You might hear this term pronounced as WISHN population. Adults and youth who are discharged from mental health, substance use, and residential programs. Adults and youth released from incarceration. Youth who are involved in the child welfare system or the Indian Child Welfare Act. Individuals who are transitioning from Medicaid only to dual Medicaid and Medicare coverage, individuals who are houseless or at risk of becoming houseless, and individuals who are have a high risk clinical need and they're in a region that's experiencing extreme weather. So this is really the group that we're going to focus on today. But again, just want to clarify that we were speaking to CMS about the risk and the gaps that can occur in the disruption when people are moving through these different stages and transitioning. So these are the groups that were approved to receive these new services through the new HRSN benefit. Next slide. So I mentioned earlier that in addition to falling within one of those populations, a person would also need to demonstrate that they met certain clinical and social risk criteria. So when we say clinical risk factors, what we mean is they need to have at least one of these conditions or experiencing one of these conditions. And then they also need to have a social risk factor. So they have one need or more related to housing, nutrition, or climate. So we just want to make sure that, again, you're falling into that group that's eligible. You do have a medical need for it since Medicaid offers medical services and we're trying to demonstrate the impact on health. And you also have a social risk factor that would indicate that you need that benefit. We'll have some more specific information to come on sort of what the documentation expectation would be here, what the role of providers and CCOs will be in documenting and confirming those risk factors. We're still developing that and working with folks to determine what makes sense to collect, what's actually needed to move forward, and we're getting some feedback from folks on what that looks like currently. So we'll have more information in a couple subsequent webinars. Alrighty, so let's dive into the climate benefits specifically. So what do we mean by a climate benefit or a climate covered service? So there's a variety of services that were approved So for example, supports that are needed based on significant or extreme weather are available. So folks might remember from a couple years back the heat dome that affected portions of the state. A number of people, unfortunately, died as a result of that situation, and we're looking to different devices that might be able to help provide air conditioners for folks who have a high medical need or are part of that high risk criteria. So this includes air conditioners, heaters for folks whose health might be impacted by weather changes. Similarly, wildfires and the risk of wildfire smoke is becoming a regular occurrence in all parts of Oregon. And we know that folks who have chronic conditions, the impact of that air quality can really affect them very severely. So air filtration devices is another example of a covered service or a covered benefit that would be included in the HRSN category. So in addition to sort of the air conditioners, air purifiers, there are also folks who have prescriptions or other things that need to be refrigerated, need to maintain a consistent temperature. And in the event of power outages, there's a real risk that those prescriptions are destroyed or unusable. So if folks have need for a refrigeration unit, if you're lacking that in your home or in your apartment, this would be another example of something that the climate benefit would potentially cover. Again, in the same spirit of in the event of a power outage, portable power supplies, another example of what we're looking to have covered under this benefit for those who need access to electricity dependent equipment and are at risk of losing power, and this would again cause a severe medical condition for them. I do want to note that we're still in conversations with CMS about sort of the definitions of some of these services and eligibility criteria. So what we're presenting today is really our intent and what we're hoping to get some final approvals on. And so a couple of these are still subject to final federal approval once we get that. Okay, next slide, thank you. Alrighty, so speaking specifically to the climate benefit, so who is eligible for the different types of services? We've sort of grouped them into two categories here. There are both the individuals who are eligible for these devices who do not need a connection to a weather-related event to receive the device. So for example, these are individuals who are houseless or at risk of homelessness, recently discharged from adult behavioral health care, and children involved in child welfare. We discussed the whole list earlier. But these are the folks who do not need a connection to a weather-related event to receive the climate devices. And in our second category, we have folks who do need a connection to a weather-related event, and there needs to be sort of a declaration that there's something occurring. So we have a heat dome, we have wildfire smoke. There's a formal declaration that this event is occurring, and that's what sort of triggers that eligibility. So for those folks, this is the group that needs to demonstrate the high risk clinical need, who reside in a region that's experiencing that extreme weather event. And again, the idea here is that this, without these devices or without these supports, it would place the health and safety of residents in jeopardy. So still working through, again, the details of sort of what that looks like in practice, but just wanted to, give you an example of sort of how a person might go through, identifying whether they actually meet the criteria and who could potentially receive a device under these circumstances. Okay, so next we'll walk through sort of a member experience example. And what we've done to lead up to this point, we've gone through sort of the major steps of what would happen, what we expect to happen, but we are really looking for your feedback on what some of our assumptions are here. We're trying to sort of take the member perspective and understand, what would that interaction look like? How would the CCO interact with the member? How would the HRSN provider fulfill their portion of this responsibility? So as I walk through this, we've tried to explain, sort of what we expect the major steps to be. But again, if there are portions here that we're missing, or you see something that you're like, there's no way that this could work, this is really the time to speak up and let us know where our assumptions might not be on point. So let's go ahead and move into the next step. So this is just one example. I want to clarify that this is one way that a person might become aware of the availability of this type of service, still focusing specifically on the climate experience. So I'm going to walk through the major steps, and then we'll go through each of the steps in more detail. So in this instance, we're going through the example of a local county health department is performing some outreach to members. So in this case, our member, Allie, gets a call from her county health department telling her that based on her records, she lives in an area that's likely to be impacted by an extreme weather event. In this instance, we're going to speak about a wildfire. So the health department informs her that she's potentially eligible for this benefit. And the next step, the health department will give her more information on connecting with her CCO to get an air filter sent to her before the wildfire smoke would potentially impact her. She'll complete a form with the CCO, and then that will be sent for approval. The service needs form will be reviewed by the CCO, again, to make sure that she's sort of checked off all of those boxes of meeting the criteria that's expected in the situation. The CCO would then approve the device. They're going to connect her with a team that will help identify, what the right device is, and then coordinate getting the air filter sent to her. And then finally, the vendor would actually deliver the device and install it if necessary. And then there's some follow-up to make sure that the unit is working and that the claim can sort of be closed out. So let's dig into this example in a little bit more detail. So in this case, we're just showing, on the left that the local health department is performing some outreach. There is a bit of a narrative here. So just giving her some information that a wildfire is predicted to impact residents over the next few days. This could impact air quality and make it difficult to breathe, and that OHP members are eligible to receive assistance getting an air filter for their home. If you're an OHP member, please contact your CCO. So this is the first portion of that activity. So in this case, we're talking both about the narrative and the conversation that's had with that member, and then sort of what happens on the back end, so the administrative component. So in this case, we assume that the county health department would be able to send out sort of a broad notice to their residents, keeping track of these health hazards and wildfire conditions, and just offering more information about why this benefit might be appropriate for them and where they might go to pursue, if they believe that this is something that they might be interested in. In this case, we're not talking about reaching out to a member specifically, but more of a broad communication saying, hey, this is available. But we'll talk about more what that direct connection to the member looks like. So in this case, Allie sees the message and thinks, yep, I'm a member of Pacific Source, as an example. That's who I get my OHP coverage through. This might be appropriate for me. Let me go ahead and give them a call. Okay, let's go ahead and click over to the next slide. Okay, so in this case, Allie reaches out to her CCO and says, hey, I got some information about the potential eligibility for an air filter. Can you help me figure out if this is something that might be appropriate for me? In this case, the CCO would say, yep, let's go ahead and continue getting some information from you and understand if you do meet the criteria and figure out what services you might need. So in this case, we've got the CCO collecting some answers from the member, adding that to the form, and just a note here that some of these questions might be self-attestation. So we don't need additional proof that she falls into this category. We'll talk more about where those self-attestations might be appropriate. So the CCO is engaging with the member. They're collecting information to determine if she does in fact meet the criteria, and they're passing it along to review and make that decision. And then the expectation is that they would contact her about whether the service was approved or denied. And of course, if it is in fact denied, she's got the opportunity to appeal just as you would with any other Medicaid service in this situation. So over on the right-hand side here, you'll see we're collecting information. They're determining whether we're missing anything before pushing it off to that next step to make that decision. Okay, so in this step, we are actually getting that approval or denial. So the CCO is reviewing the information. They have determined that she does meet the criteria, so she is approving her for the benefit. The benefit is an air filter, which is a one-time benefit. And at this point, once that has been approved, this needs to go into part of a person-centered service plan. So let's go back to the idea here that this device is intended to help her health and help her improve her health in the environmental circumstance she finds herself in with the wildfire. So we're asking for this to be documented in a person-centered service plan. We want to make sure this is the right benefit for her, that she has a follow-up plan, that people can make sure that it's still working for her. And the CCO is coordinating with the vendor to deliver that device to her and make sure that everything is working. So the information that CCO is collecting in this instance, they're saying, yep, this has been approved. We've informed the member, and we've begun to coordinate the actual delivery of that device to the member. Okay, in this step, so the CCO has contacted the vendor, arranged for that delivery. The vendor reaches out to the member, or potentially reaches out to the member and says, we're available to install your air filter. The idea here is that we're expecting just the minimum level of information needed to go to that vendor, not necessarily any medical information, but just here's the device and here's the location. And then once that product is delivered and there's some confirmation, that it's either been signed for or they've got delivery confirmation, this information goes back to the original referrer, so that if someone needs to know, whatever happened with this request, we've got some confirmation that the member was approved, they were referred for the service was delivered, and everybody sort of knows what's happened, and that the member's been taken care of. So in this step, we've got the CCO performing some follow-up and saying, right, we've heard that this has been installed. How's it working for you? Do you need anything else? And just sort of making sure that everything is working as planned. Okay. Let's move on. Okay, I went through that kind of quickly, so I know we might need to back up to answer a few questions. But one area that we just wanted to highlight for folks who might not be familiar with, if I've got a person in front of me and I'm not sure if they are in fact an OHP member, how do I answer questions about who they should talk to, or how do they reach out to their CCO? We've included a little bit of information here about how people can actually verify members' eligibility and CCO enrollment. So I know we'll be sending these slides out to folks afterwards, so that you have this information available to you. So a couple different ways. We've got an online option. You can also call. We've got a couple help desk numbers here, but they should be able to provide information on whether this person is in fact an OHP member, if they have a CCO that they've been assigned to, and that'll help, hopefully help route people to the right supports. Alrighty, so I'm going to pause there and see, Jessica, I'm sure we've gotten some questions in the chat, and see what we need to answer today.
Thank you so much, Megan. And yes, we wanted to make sure we had plenty of time to not only talk at you, but to speak with you. So I see a few things in the Q&A and in the chat. Is installation included as well as supply of the device? I think we alluded to that once we were in the walkthrough, but I just wanted to see if Megan, you or Josh want to say anything about installation.
Josh, I will defer to you on
that. Installation is a billable aspect that we're looking to include. I'm not sure if all the details have been worked out, but it will be available, yes.
Thank you. And then another question is, what if county health department has been significantly cut back because of budgetary issues? Are there other entities we can work with? And I want to start by saying this was one example of many, so it wasn't the only way that someone could be considered for a climate device or other service. But having said that, I will defer to the folks who are smart subject matter experts.
Yes, absolutely. So first want to acknowledge, yes, we've definitely seen a lot of cutbacks in county health and public health funding, which is extremely unfortunate. But as Jessica mentioned, this is just one example of how a person might become aware that the service would be available. We've got a couple of other examples of, the CCO performing outreach, a person, coming into a provider's office or a medical provider's office and getting some information that way. But this was just one example of specific to a climate event of a way that a person might become aware that they could have this access to this type of device.
Let's see here. I have a lot of great questions popping up. What does this look like for folks who are renting with things like air conditioner units and air filters? I imagine landlords would need to be included and adds another step to a burdensome process. I think this might be another Josh question.
Thanks, Jessica. I was actually just typing a response to that in the Q&A. All of the devices that we're going to be distributing are portable. They will not require any structural impact to a unit. So for legal purposes, there shouldn't be anything prohibiting a recipient from utilizing these devices, even if they are in a controlled environment like an apartment building or something like that. In our past state program, we ran into some issues around those concerns with landlords around our ACs. And so what we did in regards to that was we created a kind of a legal letter of approval stating that these devices are approved for use, they cannot be prohibited. And in the transition into the climate benefits under the waiver, I think we're going to have some assisting supports for subjects like that that come up for recipients. If they do have issues, we'll have either through client services or some other agency office will have assistance to resolve those things.
And then I see another question that is similar, is what type of check will be done to make sure that folks have the power they'll need to operate the item? And this is from someone who is involved with energy assistance and deals with folks who have lost their power. I'm sorry, I think that's also Josh. I think all roads are leading to you right now.
No problem. I can jump in on that one too. In regards to energy assistance, that is not going to be covered under the climate benefits of the waiver, but it is going to be an optional support under the housing benefits. So our goal is that in the member connection, we are doing our due diligence outreach to see what other services that we can connect them with that they are in need of. So while it might not fall under the climate benefit, which gets them the device, we may be able to find other avenues under the housing supports.
And I see a few different questions around repairs and replacements of air filters and other ways to support the devices ongoing.
So devices that we're looking to purchase will come with a manufacturer warranty that ranges by devices anywhere from 1 year to 3 years. A member who has issues with a device will be able to reach out to the manufacturer to initiate a process of either a troubleshoot or a replacement. But the providing organization will be responsible for assistance in that coordination of a troubleshooter replacement call if the member runs into any issues. I know with some of our bulk purchases of devices for the state program in the past, a recipient doesn't necessarily have a receipt or a serial number for their device. So sometimes when reaching out to a manufacturer, they may run into issues. This is where we would just appeal to the provider to assist in those instances. But they will be available. And then for the air filtration devices, I believe that we've got an approval for up to 2 replacement filters per year under normal request situations. And then anyone who's residing in a region that is experiencing prolonged periods or extreme periods of poor air quality will have the ability to request additional replacement air filters.
Thank you so much. We have a few different questions around eligibility and how folks get approved for these benefits.
Yeah, I can speak a little bit to that. So I think the question in the chat about issuing guidance to CCOs. We are issuing guidance to CCOs about how to establish eligibility. So things like what type of data sources would be expected to be used to verify. So we've got a few work sessions that are still underway on sort of what the appropriate types of data would be to use there. So that guidance is evolving, but we are definitely issuing guidance on what we expect as far as the process for review and determining eligibility. I see the second question in there, Jessica. Do you want me to go ahead and tackle around appeal? Okay, so the question is, what's the process of appeal if a member disagrees with their eligibility decision? So since these benefits are approved by CMS as covered services, it's the exact same process as you would if you were denied any other Medicaid OHP benefit. So it's going to be the same notification. You would have the right to appeal. So none of that is going to differ based on these devices being available. So that should stay the same.
Thank you so much. I do want to call out everyone that I am paraphrasing some of these questions because there are similar ones popping up in the Q&A as well as in the chat. So if I'm not doing your question justice, please let me know. And there's a lot of great stuff in here. I have a question about using CIE and if that can be used to help with some of these steps.
That is the hope. So I know there are CIE platforms that are in use in various parts of the state. And one of the things that CMS has asked us to do as part of implementing the service availability is to do what's called a closed loop referral. So making sure, as part of the step that I mentioned, that whoever that original referring provider is, that they've got some idea of what happened at the end of that process. So did the member actually receive the service? Did they get the benefit? What would happen, so it doesn't just sort of become a referral that goes into nowhere. So CIE can definitely be used for this. We're still exploring what options we have for expectations as far as what CCOs will be expected to do and providers, but absolutely CIE will play a role in helping to close the loop when that's already in place with those providers.
Thank you. I do want to say, I see a question about learning more about young adults with special healthcare needs and what those special healthcare needs are. And I think that is probably an excellent topic for the future, but I would want to do it justice, which is why I'm calling it out, but not giving you a complete answer. I'm wondering if that's okay, if we can come back to you with the experts on young adults with special healthcare needs.
Sounds right to me, Jessica.
I'm seeing a statement and question around how this benefit will or won't line up with helping houseless individuals and if there's any guidance there. Including if they could live doubled up to obtain a device in a home they're sharing with others.
So I don't know the answer to that. Josh, I don't know if you have any insight on how we've thought about devices when it's a person living in a doubled up situation. Has the work group given any thought to that, or do we need to take that one back?
We've discussed scenarios like that in previous eligibility meetings, and as far as I'll say, to my knowledge at this point, I believe that as long as a member has a need that they've identified and they have a residence where they can plug a device in safely, they should be eligible for distribution. So if they're living with a relative or a friend or something like that, even some RVs have proper outlets and things like that, we would allow devices in those settings. Yes, we do plan to implement flexibility in to try and reach a member-centered plan. So I did see another question in the chat about flexibility for devices, in reference to air conditioners. Not all windows are the same in apartments and things like that. Providers will have the ability to interact with the member to meet their needs. We're not trying to fix one device for every person's living situation. We recognize that's not realistic in a sense. So while we are giving CCOs and such guidance on devices and safety protocols and things like that, they will have that flexibility to meet a member's needs. And so our goal is to provide to the best of our ability, and especially around some of those transition populations where issues such as housing stabilities or things like that come into play. So when we can, our goal is to meet a member's needs.
Thank you, Josh. I have a question about if people get a device this year, are they able to get another one next year, or is there a check in place to limit how and when people are eligible for devices if they've already received them?
I'll jump in on that one again. Another great question. I don't believe there's a general rule of thumb across all of the devices. We're going to be putting further guidance in on each particular device when it comes to that, because some of these devices are expensive and the longevity or estimated life of the device is much longer than a year's period. So we wouldn't have any need to issue another one within a year's period. Other devices such as portable heaters or air purifiers, we understand that some of the lower cost devices, they have malfunctions, they have a higher rate of failure, things like that. So after a 1 year period, if they still had a need and they were experiencing any issues with a device that they had gotten previously that couldn't be resolved through troubleshooting or warranty replacement, they would be eligible for another device.
Thank you. And another question, that's probably another Josh question, is do we have an estimate of how long we expect this process to take from the member request to installation?
We don't have any sound estimates right now. Obviously, the intention is as fast as possible. There are all kinds of factors that might impact delivery times, such as more rural areas, areas experiencing inaccessibility due to environmental issues, things like that. In a normal non-emergency situation, we are focused on getting a person through the process from referral to a device within 2 weeks, I believe, as a cap. Ideally, once the referral is submitted and approval begins, a device should be reaching a recipient within a week, unless there's some outstanding circumstances where they require additional either installation assistance or yeah, I guess that would be it. If they required some kind of installation assistance, it might require a little bit of extra time to arrange that.
Thank you. Any information about the potential increase in energy bill for the user?
Josh, you're on a roll.
That's me. We do have some initial estimates on what the increased costs would be for running each of the devices. These are estimates such as for air conditioners, we estimated what running a unit pretty much daily for the entire summer would cost, and it equated to about $100 to $110, depending on the area that the person was in. So we do have some numbers around the increased usage costs, whether that be for a month period or a seasonal period, which we are going to hopefully cross-share with housing supports and get them some more information. So If they do receive additional requests for assistance due to things like receiving a climate device, they'll have some better references for what that would entail.
Thank you. And I am realizing that we're getting pretty close to the end of the hour. So I do want to continue to welcome people to put into the chat or into the question and answer box specific questions they have around what we've shared today. But also I want to open up the conversation a little bit so that we can make sure we're being responsive to your priorities, your interests, and your questions as we look forward into our next webinar and other opportunities for engaging with you all. So based on what we've shared so far or in other past webinars you've been in, we're wondering if there are any additional questions you have, big picture, any additional information that you feel like you really want us to dig more into. For instance, I saw the request for young adults with special healthcare needs and talking more about those details. Are there other aspects of the waiver that you've heard us talk about and you want to learn more and you want us to bring more updates of that type to this webinar, this monthly webinar? And I do want to give folks time to either raise their hands or put something in the chat or the question and answer box, which is why I'm talking at myself right now. And I think actually while we hold this open for this, I do also want to show you ways in which you can get connected right now. So we continue to have our 1115 waiver.renewal inbox for specific questions. If there's something that you have a need for engagement, if you have a specific question you need an answer to from a subject matter expert, this inbox is a really great place to go. We continue to update our website and including, and I saw a few requests in the chat for this, we always put our webinar content up on our public website. We include the slide deck in PDF format, and we include a recording. And we will also repeat this content in Spanish later this month, so that once it is done, will also get uploaded, and we will make sure that that's available to folks. We have a link on that public website to register. If you're here, you are registered because we had it work so you're registered for the whole rest of this calendar year. But I saw some people who are interested in getting this content or future webinars to their colleagues. And absolutely, we would love to have more folks here. And I will see about my multitasking is not up to par today. I will see, maybe I'm going to put this out and hopefully one of my folks helping me can get a direct link to the webinar registration into the chat for us, because that's the easiest way to get folks into these future events. And the same registration will get you November and December's updates. And we also have started a newsletter, an external newsletter. So if you want to get onto that mailing list, if you aren't yet already, that is this final link that is here on this slide. And so those are some concrete ways to stay connected right away, in addition to anything that you all have put into the chat or into the questions box while I've been talking. And I do see those resources have been listed. Thank you so much. And I see a call out for more housing related needs and services. Thank you. I do also want to thank you all for being here today, for continuing to be engaged with these processes and letting us know where your priorities are, what your questions are, what you're excited about and what you're worried about. And so we are very thankful that I think we definitely got to over 100 folks here today. If there is anything at all we can do to be better partners, better collaborators, please don't hesitate to reach out to us. I think we have a few more minutes, but I also don't want to have us hang out in a webinar just because we had the full hour. So I'm happy to continue to hold open the chat, keep an eye on things, but thank you all for being here, and you're welcome to have a great rest of your day, and you don't have to hang out with me just because I'm going to stick around for the next 5 minutes. Thank you all.
Thank you, Jessica.
Thank you, Megan. And thank you, Josh. Thanks for being put on the spot multiple times as our resident subject matter experts on all things climate.